Diabetes Pathophysiology by Dr. Jaisy Varges. Diabetes is a disease that affects the pancreas and therefore affects the whole metabolism of the body. The way that we understand it is our body needs glucose to function. Many people don't understand, but glucose is what the brain uses to function as its primary source of energy. Insulin is produced in the beta cells in the pancreas, and it is produced as demand comes. When we eat something, our small intestine breaks down the foods into simple sugars, which are called glucose. When the glucose freely flows in the blood, the pancreas receives an order to produce insulin in order to bring the levels down. And the way that it works is through facilitated by diffusion, which means that on the cell wall, in the lipid bilayer, there are gates or insulin receptors that are basically like a gatekeeper. They open the cell wall and they allow the glucose to enter the cell in order to make the energy that will be required in order to function. So how do we diagnose diabetes? Basically, there are two types of diabetes, diabetes 1 and diabetes type 2. Diabetes type 2 is something that we see on patients when they're at their older age or when people that have predisposition for it due to family geneticists, or is something that comes with obesity. And the way it does is not that the pancreas stops producing insulin, it just produces it, but the body resists the insulin. Basically, what that means is that the cells are not able to open up to receive the glucose that will enter the cell. When that happens, we have to really understand one thing. It's not that the pancreas stops producing insulin, it's just that the body's not absorbing the glucose because the receptor cells are not opening up, they become damaged. And what happens as a result of that is just lets the sugar, the glucose free flow in the blood. So 90% of the diabetes type 2 is because of obesity. And this is something that can be easily identified in the office. What happens is when a patient comes to you, we have to really understand one thing. If they are low energy, if they're gaining weight and they cannot lose weight that easily, we have to do one thing as screening. The most popular test that we have is the hemoglobin A1C. And what that does, it lets us know what the usual glucose levels were in the previous 3 months. If they were higher than 6.4, then we understand that to be a precursor for diabetes later on. There are other effects that will ruin the ability to for the glucose to be absorbed. If we have resistance to the diabetes, the liver will produce ketones. When the free glucose is flowing through the blood, you may have a lot of glucose, but the cells are not absorbing it, which means that the people are going to be low energy. The brain is going to receive that because the brain feeds on glucose, and it will order the liver to produce a backup system of glucose, which is called ketones. Once ketones go into the blood, they start going up higher and higher to meet the demand that the body has for glucose. And this is something that can become very, very dangerous because once the ketones go extremely high, it produces extreme acidity in the blood, thereby causing something that we know as diabetes ketoacidosis, and that is a medical emergency. There's other types of diabetes that we have, such as gestational diabetes. This is only seen during pregnancy. However, we have to let these mothers to be known that once gestational diabetes sets in, it will basically go away on its own. But within 10 years, most likely these women will become type 2 diabetics. So gestational diabetes is basically a sign of what to look forward in the future. There's another type of diabetes that is basically the opposite of mellitus. It's called insipidus. And this is because of the decrease of the antidiuretic hormone. And these are known for the three P's that we know: polydipsia, polyphagia, and polyuria. And this is something that we can really see in only when we do blood work, and then we understand that there will be something. Also, there's neurogenic diabetic insipidus that is usually caused after a patient has had a traumatic brain injury. The urine output is going to be greater also, and this is another sign that diabetes is setting in. And there are also going to be excess sodium in the blood, or in the urine, I'm sorry, and it's going to be hypernatremia. And the osmolality is also going to be affected by this. What are the complications of diabetes mellitus? You can see it on the slide, but it basically comes down to one thing. Excess sugar will block the passage of blood through the capillaries. Where do we find the finest blood vessels in the body? In the eyes, of course, in the heart. When we see a lot of the blood vessels, the arteries that feed the cardiac muscle, they will become blocked. At the tip of our fingers, on our toes, in the kidneys, especially. And what's going to happen if we do not control that diabetes in the long run is going to cause damage to the heart, to the eyes, to the kidneys, and basically to the limbs. Thank you very much for your attention. And if you have any additional questions, Dr. Vargas will answer them.